There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
There are so many answers to that question that I have written a whole website around it. Diet and lifestyle changes should come first, including cutting back on sodium, following a DASH-style Mediterranean diet and cutting back on caffeine and alcohol. Supplements with evidence for lowering high blood pressure include calcium, coenzyme Q10, omega-3 fish oil, lycopene, magnesium, potassium, vitamin C and vitamin D. Among the herbs, there is evidence for hibiscus tea, chamomile, garlic, hawthorn, lemon balm, reishi mushroom, rhodiola and valerian. In fact, there are so many natural approaches to lowering a high blood pressure. Eva devoted a whole site to it. You can find all my advice at Lower Your Blood Pressure Naturally. Let me know if you need any more pointers. Best wishes, Sarah B. There are so many answers to that question that I have written a whole website around it. Diet and lifestyle changes should come first, including cutting back on sodium, following a DASH-style Mediterranean diet and cutting back on caffeine and alcohol. Supplements with evidence for lowering high blood pressure include calcium, coenzyme Q10, omega-3 fish oil, lycopene, magnesium, potassium, vitamin C and vitamin D. Among the herbs, there is evidence for hibiscus tea, chamomile, garlic, hawthorn, lemon balm, reishi mushroom, rhodiola and valerian. In fact, there are so many natural approaches to lowering a high blood pressure. Eva devoted a whole site to it. You can find all my advice at Lower Your Blood Pressure Naturally. Let me know if you need any more pointers. Best wishes, Sarah B. I am an allopathic physician, and I will give you a different answer than the other answer. Reduce the sodium in your diet. If you are deficient in vitamin D, which can be tested, then take more vitamin D. However, blood pressure elevations are mostly genetic, and unless you can go back and change to your parents where there is not much you can do about it. Don't take too much salt. Probably reduce animal fat and protein in your diet. Get regular exercise and regular sleep. And pick your parents wisely. Eat lots of whole fruits and vegetables, 10 servings each day if you can. They are rich in potassium and trace minerals that all work together to help your body regulate blood pressure. Do not take potassium supplements, they can kill you by interfering with regulation of your heart rate. Quit smoking and drinking any type of alcoholic beverages, even wine. Alcohol and smoking raise BP, at least temporarily, but if your BP is high and you inhale or ingest something that spikes it higher, you could have a stroke or heart attack. Exercise at moderate intensity for a full hour every day. Push yourself, but not too hard. You don't want to cause your BP to get too high during exercise. If you can, get referred to cardio rehab, where medical professionals will help you learn the appropriate level of exercise for your condition. When I had my stroke, I was in bed or a wheelchair for over a month, eating hospital food. My BP was high and they put me on multiple BP meds before I was released. After I was able to do my own food shopping and preparation, I resumed my normal diet of lots of vegetables and my BP began to drop. As I was able to walk better and I began exercising more, my BP dropped further. One at a time, I've been taken off the BP medications as my lifestyle began reducing my BP naturally. I still take my BP 2x per day, every day, and keep every reading in an app on my phone to show my doctors. I definitely don't want to risk another stroke. If you are deficient in VD, you might take some vitamin D supplement that might help with your blood pressure. Vitamin D deficiency, can it cause high blood pressure? But my blood pressure always reads high on machines at drugstores while it is normal to low using a real sphygmomanometer, so have your blood pressure checked by a doctor/nurse. People who are overweight and sessile can bring down their blood pressure by a good diet and exercise program coupled with weight loss. In any case, see your doctor, as high blood pressure causes arterial disease in the heart and brain that can be mitigated by control of blood pressure. If you cannot control your blood pressure naturally, then you need medication.